Lung cancer is the leading cause of cancer death in the United States. It may not be the most prevalent cancer, but it's the most fatal cancer. More patients die of lung cancer than any other cancer. Lung cancer is relatively silent until it has spread, or when it causes symptoms, it's usually in its late stage. And those symptoms are typically hemoptysis, or coughing up blood. You can have chest wall pain. You can have hoarseness, or involvement of the recurrent laryngeal nerve, difficulty swallowing if it's pushing on the esophagus. These are all very late stage symptoms, but typically when it grows inside the lung, it is relatively asymptomatic. We have started screening programs in order to identify patients and potentially screen for patients for earlier diagnosis and treatment. When we look at lung cancer, we break it up into 4 stages, stage 1 through 4. Stage 1 is early stage, stage 4 is late stage. We typically operate on patients who are stage 1 and 2 lung cancer, and some stage 3, early stage 3 lung cancers. Unfortunately, the majority of the patients who present with lung cancer, 50% of them are already stage 3 and 4. In order to undergo a lung resection, you have to have an adequate amount of lung function remaining after the resection in order to do your daily activities. And so 50% of the patients who are even a surgical candidate or a resectable candidate are not operative candidates because their lung function is poor. So typically when we talk about all lung cancers, only 1 in 4 are able to get potential cure with surgery. The definitive treatment is surgical resection.